Hello everyone, I'm Dr. Ardian Cole. I simplify complex medical science into practical, evidence-based health advice to help you make smarter decisions for your well-being. Let's begin. Your liver works around the clock without asking for attention. It filters toxins, processes nutrients, stores energy, and supports hundreds of vital functions that keep your body alive. Yet millions of people unknowingly overload this remarkable organ every single day. Fatty liver disease often develops silently, causing little or no discomfort until significant damage has already occurred. The encouraging news is that, unlike many organs, the liver has an extraordinary ability to repair itself when the right lifestyle changes are made. But not every popular health tip is supported by science. In today's video, we'll separate medical facts from common myths and explore the proven strategies that can help reduce liver fat naturally and restore healthier liver function before the condition becomes far more serious. Many people immediately blame greasy foods when they hear the words fatty liver. While eating too many unhealthy fats can certainly contribute, modern medical research paints a much bigger picture. For most people with non-alcoholic fatty liver disease, the real problem begins with how the body handles sugar and energy. Every time you consume large amounts of sugary drinks, desserts, refined bread, processed cereals, or sweet snacks, your blood sugar rises rapidly. Your pancreas responds by releasing insulin, a hormone that helps move glucose into your cells. The problem begins when this happens day after day for months or even years. Your body's cells slowly become less responsive to insulin, a condition known as insulin resistance. As a result, your pancreas produces even more insulin to compensate. High insulin levels encourage your liver to convert excess glucose into fat, and that fat gradually accumulates inside liver cells. At first, you may feel perfectly healthy. This is why fatty liver is often called a silent disease. There may be no pain, no obvious warning signs, and no noticeable symptoms while fat quietly builds inside the liver. Eventually, however, this excess fat can trigger inflammation, making it harder for the liver to perform essential tasks, such as filtering toxins, regulating cholesterol, and maintaining healthy blood sugar levels. What surprises many people is that fatty liver isn't caused by a single unhealthy meal. It's usually the result of small daily habits repeated over many years. That's also why quick fixes rarely work. Lasting improvement comes from consistently changing the habits that created the problem in the first place. Fortunately, the liver is incredibly resilient. Scientific studies have shown that reducing liver fat is possible when insulin resistance begins to improve, and that process starts with understanding which everyday choices are helping your liver recover, and which ones are quietly making the condition worse. Once you understand what causes fat to build up inside the liver, the next question becomes even more important. Which foods help your liver heal, and which foods continue feeding the problem? Now that you understand how fat slowly builds up inside the liver, the next step is learning how your daily food choices can either accelerate healing or continue the damage. One of the biggest mistakes people make is believing they need a special detox drink or an expensive supplement. In reality, the strongest medicine for a fatty liver is often found in the everyday foods you choose to eat or avoid. The first priority is reducing foods that repeatedly overload the liver. Sugar-sweetened beverages, processed snacks, pastries, candies, white bread, and many packaged breakfast cereals cause rapid spikes in blood sugar. Every spike forces the liver to deal with excess glucose, increasing the likelihood that more fat will be stored inside liver cells. Even foods that appear healthy, such as flavored yogurts, sweetened coffee drinks, or fruit juices with added sugar, can quietly contribute to the problem if consumed regularly. Instead, focus on foods that naturally support healthier metabolism. Fill your plate with colorful vegetables, leafy greens, broccoli, cauliflower, cucumbers, tomatoes, and peppers. These foods are rich in fiber, vitamins, and antioxidants that help reduce inflammation while improving overall metabolic health. High-quality protein from fish, skinless chicken, eggs, beans, and lentils also plays an important role. Protein helps preserve muscle mass during weight loss and keeps you feeling satisfied, making it easier to avoid unnecessary snacking. Healthy fats should not be feared either. Foods like avocados, olive oil, walnuts, almonds, and seeds provide nutrients that support heart health and can be included as part of a balanced diet. The real goal is not eliminating all fat, but replacing unhealthy processed foods with whole, nutrient-dense options. One interesting area of research involves coffee. Several scientific studies suggest that drinking unsweetened coffee in moderation may be associated with better liver health and a lower risk of liver scarring in many adults. While coffee is certainly not a cure, it reminds us that liver recovery is built on consistent daily habits rather than miracle products. Remember, your liver doesn't expect perfection. It responds to consistency. Every healthier meal is another opportunity to reduce the stress placed on this remarkable organ and move one step closer to recovery. Improving your diet is only half of the solution. The next step may actually speed up liver recovery even more, and it doesn't require expensive equipment or complicated fitness programs. By now, you've seen how nutrition plays a major role in reversing fatty liver, but many people are surprised to learn that food alone is rarely enough. Your liver doesn't work in isolation. It responds to everything happening inside your body, including how active you are, how well you sleep, and even how much stress you experience every day. These lifestyle factors may seem unrelated, but together they have a powerful influence on how quickly your liver can recover. One of the most effective tools for reducing liver fat is regular physical activity. You don't have to become an athlete or spend hours in the gym. Scientific research consistently shows that moderate exercise, such as brisk walking, cycling, swimming, or strength training several times a week, can significantly improve insulin sensitivity. When your muscles use more glucose for energy, your liver has less work converting excess sugar into fat. Over time, this simple change can help reduce fat stored inside the liver while improving your overall metabolism. Sleep is another factor that is often overlooked. Poor sleep doesn't just leave you feeling tired the next day. It can disrupt hormones that control hunger, increase cravings for sugary foods, and worsen insulin resistance. Many people unknowingly enter a cycle where lack of sleep leads to poor food choices, which then places even more stress on the liver. Aiming for 7 to 9 hours of quality sleep each night gives your body the opportunity to repair tissues, regulate hormones, and support healthier liver function. Chronic stress also deserves attention. When stress becomes constant, the body produces higher levels of cortisol, a hormone that can influence appetite, blood sugar regulation, and fat storage. While stress itself doesn't directly cause fatty liver, it often encourages unhealthy habits such as emotional eating, inactivity, and poor sleep. Learning simple stress management techniques like deep breathing, regular walking, spending time outdoors, or practicing mindfulness can indirectly support liver recovery by making healthier choices easier to maintain. The most important lesson is that lasting recovery doesn't come from one perfect habit. It comes from combining several small improvements that work together. Each healthy decision strengthens the next, creating a positive cycle that allows your liver to heal gradually and naturally. Understanding the science is only the beginning. In the final part, we'll bring everything together into a simple, practical plan you can start following today to give your liver the best possible chance to recover. After understanding what causes fatty liver, learning which foods support recovery, and recognizing the importance of exercise, sleep, and stress management, the final step is turning this knowledge into daily action. One of the biggest reasons people fail to improve their liver health is not because they lack information, but because they try to change everything overnight. They follow an extreme diet for a week, exercise intensely for a few days, and then return to their old habits. Your liver doesn't need perfection, it needs consistency. Start by making one meaningful improvement at a time. Replace sugary drinks with water or unsweetened tea. Build each meal around vegetables, lean protein, and high-fiber foods. Reduce highly processed snacks and choose whole foods whenever possible. These simple changes help stabilize blood sugar levels and reduce the amount of fat your liver has to store. Next, make physical activity part of your routine rather than an occasional event. A brisk 30-minute walk most days of the week, combined with light strength training 2 or 3 times weekly, can significantly improve insulin sensitivity and support gradual fat loss. Even losing 5 to 10% of your body weight, if you are overweight, has been shown in many studies to reduce liver fat and improve liver function. The goal is steady, sustainable progress, not rapid weight loss through extreme dieting. It's equally important to work with your healthcare provider if you have conditions such as type 2 diabetes, high cholesterol, obesity, or high blood pressure. These conditions often occur alongside fatty liver disease, and treating them together gives your liver the best opportunity to recover. Regular medical checkups, blood tests, and imaging studies can help monitor your progress and ensure you're moving in the right direction. Remember, there is no miracle supplement, detox drink, or overnight cure that can replace healthy daily habits. Your liver responds to the choices you repeat consistently, not the promises made by quick-fix advertisements. Every healthy meal, every walk, every good night's sleep, and every positive decision becomes another step toward restoring one of the hardest working organs in your body. Fatty liver disease may develop silently, but it doesn't have to define your future. The encouraging truth is that your body has an incredible ability to heal when you give it the right support. Small, consistent changes made today can lead to remarkable improvements months from now. Progress may not happen overnight, but every healthy decision is an investment in a stronger, healthier future. Thank you for spending your time with me today. I'm Dr. Ardian Cole, and I truly hope this information helps you make confident, informed decisions about your health. If you found this video valuable, consider sharing it with someone who might benefit from it as well.